The availability or lack thereof of treatment for perinatal mood and anxiety disorders is what is sometimes called a treatment desert, with very few options available, especially for historically excluded populations. In order to find a specialist in maternal mental health, women often have to travel to large academic institutions that may be geographically inaccessible. They may have to spend months on a waiting list or pay enormous amounts of money out of pocket for cash only services. And this was really one of the greatest motivating factors in the development of the Maternal and Family Center here at Care Plus New Jersey. We wanted to really bring care to all individuals, regardless of ability to pay, and without having to spend months on a waiting list. And also what was touched on, treatment really starts with screening. If you don't know that there's a problem, then you're not going to know to treat it. And screening is not a one-time occurrence. It needs to be done pre-conception with the primary care doctor and or the OBGYN. It needs to be done during pregnancy visits, in the hospital, in the days after birth, and then ongoing during the postpartum period. We use several commonly used screening tools to assist healthcare professionals, such as the PHQ-9 and the Edinburgh postpartum depression scale. But once a perinatal mood and anxiety disorder is identified, treatments that are available can range from increased family support to case management and social interventions, one-on-one therapy, group therapy, and potentially psychotropic medications, which kind of carry a stigma in and of themselves. And a discussion about medications in pregnancy and breastfeeding could in and of itself fill several lectures, but I will make this statement. Medications can be used in pregnancy and during breastfeeding, and while they may carry some risks, as a very general statement, the data suggests that while the risks of each medication are still being elucidated with ongoing research, the risks of untreated or undertreated perinatal mood and anxiety disorders is very definitive. And therefore, medications can play a role in moderate to severe mental illness in this population. So to kind of sum it up, screening, and more screening. We have seen very clear racial disparities with regards to the screening process. And the treatment modalities used have to be individualized, they have to be multimodality, multidisciplinary, and including what is probably the most important, which is improved social support.